The problem I had was I had some bridge work done 20 years previous to coming here, and that it failed, and that was the problem that I had at the time. The options that the NHS offered me was going back to partial palate, which I'd had loads of trouble with before. That's why they put the bridge in. The bridge couldn't be renewed, and he suggested that I have a dental implant. I worked with the guy that used Ewan Bramley, and he recommended it. It was well explained thoroughly, because I mean obviously I had never had anything like that done before, and it sounded massive, you know. But Ewan Bramley, I spoke to him, and he went through the whole procedure and how long it would take. It would take several weeks of treatment, and it did. But it was fine, absolutely first class. I mean, you know, I couldn't emphasize enough, you know, because I was very apprehensive about it, because it sounded quite dreadful, really, but it wasn't, and the aftercare was absolutely spot on, and has been ever since. I knew I was dealing with people that knew what they were doing, let's be honest. I mean, it wasn't a problem for us at all, really, although it was, you know, you're a bit anxious at the time, but I didn't need to be. It's just like having your own tooth. You don't even know it's there. I wouldn't have liked to have had nothing in the place of the implant. You know, I don't think that I would have felt self-conscious, and now I just feel like me. I will go back to the implant. When he did the implant, he had to do a root filling, and when he mentioned root filling, I have had root fillings before, and I tell you, it wasn't a good experience. And I said to him, I don't really like the sound of a root filling, and he asked us why, and I told him. And I always remember he said to me, you will feel no pain here at all, and I can guarantee that. And I took him at his word, and I had no pain whatsoever. And that was a surprise, because it might have been a long time since I'd had a root filling, but I had a lot of pain with it. And I'm no hero, I can tell you. So if you can do that sort of thing, and I suppose the implant itself was even more than the root filling, but I hadn't had one of them before. But I had experience of root fillings, and it wasn't a good experience. And I didn't feel anything whatsoever, no pain whatsoever. Not even afterwards when the anaesthetic was wearing off, there was nothing. So confidence was there straight away, you know. You get an hour's appointment, you know. When I had a dental hygienist in the past, I've sat longer in the waiting room than what the dental hygienist did, you know, and it cost us. Very thorough, completely thorough. And the advice was really helpful, because I'd always had difficulty in flossing, arthritis in my hands, you know, and I got a lot of help with interdental brushes and things like that from the hygienist here. The service is absolutely, yeah, I come back all the time. I've forgotten the NHS now. It's a whole package, isn't it? You know, you come in, you're welcomed, you're felt at ease straight away. For anybody that is anxious, that is sharp as that sharp goes, you know, and thoroughly professional, you know, everybody.